Hello and welcome to the Public Health edition of SHEP's Professional Insights series. I'm Danielle Breidung, a SHEP alumna and graduate of Washington and Lee University. Now I have the pleasure of working with SHEP as a consultant, and alumni engagement is one of my main projects. So I'm so glad to be here with all of you this evening and to have this conversation with our three accomplished panelists who are also SHEP alums. So if you don't mind, panelists, I will ask you each to introduce yourselves. Tell us your name, where you're from, where you went to school for your undergrad or any other degrees you may have, and maybe a fun fact so we can get to know you a little better. And I will start with Kirsty.
Hi, everyone. I'm Kirsty Klein. I graduated in 2017 from Furman University with the Bachelor's of Science in Health Sciences. And I am currently based in Atlanta. I'm getting my master's in public health at Emory Rollins School of Public Health in the Global Health Department, a certificate in social determinants of health. And I work part-time in recruitment and community engagement for clinical trials related to COVID and HIV vaccines. Oh, and a fun fact, I have three sisters. One of them is actually on the call, and she's also a Shepherd alumni.
Yay, I love it. Shout out to Kirsty's sister. We were actually talking about you in the intro, so that's so fun. She can tell you what we said. I'll turn it over to Dan.
So hi, everyone. My name's Dan Carpintero, originally from Cincinnati and currently located in Cedar Rapids, Iowa. I went to undergrad at Berea College and graduated in 2014. Did a master's degree at the University of Iowa in healthcare management and policy. And a fun fact about me is I actually really enjoy Rubik's Cubes.
Seems like a good way to relieve stress these days. Take your mind off of things.
Yes.
Jamila, I'll turn it over to you.
All right. Hello, I am Jamila Seaton. I did my bachelor's in math at Washington and Lee, graduated in 2009. I then did my master's in public health, epidemiology, and biostatistics at the University of South Florida, originally from Guyana, South America, which could kind of be my fun fact too, but I'll share. My sister she has her PhD in microbiology, and so we have been quite the team during COVID times. We have been just kind of nerding out a little bit with being able to do the public health, and then her having the more laboratory science background. So we're probably the only two people who, as a family, COVID has been our fun time.
And Jamila, I may have missed this, but did you tell everyone where you are located now?
I did not. I am in Green Bay, Wisconsin. I work for United Healthcare as a healthcare economics analyst.
And there's a fun story about why she's there, but maybe she'll tell you that later. So now that you've gotten a chance to meet everyone, I want to transition to their SHEP internship experiences. And I'm curious, when you did your internship, what agency you were matched with, where it was located, and your biggest takeaway. And we can go in reverse order.
All right, so I did my internship in 2007 with the Delta AHEC, so Delta Area Health Education Center. And it was actually my first exposure to public health because those were the first people I knew immediately who actually had studied public health, and at the time kind of a new upcoming area. I'm sorry, okay, I'm blanking on
No problem.
on
no,
what
that's
else
great.
you said to
so
share.
You said where it was, the agency, and when. So 3 out of 4, that's terrific. The fourth piece is just your biggest takeaway.
Yes, yes. Biggest takeaway, we talked a lot in poverty class about the invisible poor. And I think I lived in Marvel, Arkansas. The five of us lived in Marvel, and then two of us worked in Helena, which is about 30 minutes away, I think. And I think for me, it was just these were two communities that felt so separate from the rest of America that I had been to, and it just really brought to light when we talk about invisible poor, when we have these conversations on the national level, how easy it is for communities to be missed.
Such a salient point right now. Dan, where'd you do your internship?
I actually did my internship in Marvel, Arkansas as well, at the Delta AHEC, so Delta Area Health Education Center. Mine was actually in 2013, so a couple years later. My reason for going there was that so many people had already talked really well about the Shepherd program at Berea that I thought, wow, this would be a great program for me to kind of understand what path I want to take to my end goal in my career. And I really want to work with free clinics as like the pinnacle of my career. That's what I want to do. So I thought that this would be a great understanding and things for that. So did my internship there again with 4 other people. So it was a 5-person group. And probably the biggest thing that I took away from that is how public health affects really every portion of your life. I wanted to be a PA at the time and thought that would be my route, but went there and kind of understood some different things and learned how, public health can affect everything, but how easy it is to let it fall to the wayside. And so one of the things we should do is educate the youth and children on health and how important it is for you in daily life and how it can be ever present in your future. So.
Thank you. Kirsty?
So I don't know if this is a surprise, but I also did my internship at AHEC. I think they kind of rebranded between when you were there, Dan, and when I was there. I was there in 2015, so only a couple years later, but I think they now call it UAMS East. So it's part of the University of Arkansas Medical Sciences location. So yes, I was in the same place, lived in Helena, really enjoyed my time there. I think the biggest takeaway I took from my experience was just the challenge of being adaptable. When I applied for the Shepherd program, I thought I wanted to go to a city and like have this urban internship experience. It was kind of my first internship or summer away from home. And I was kind of surprised when I heard that I was placed in a rural community in a state I had never been to, in a community I really knew nothing about. And so I was a little bit hesitant at first, but I'm really, really glad that I took the challenge to move to Helena for the summer and learn about a place that I didn't know about, because it really pushed me and challenged me to be adaptable. And I've learned that that's a really important skill when you're working in public health. You can't always seek out opportunities that you want for yourself. You have to see what kind of opportunities are available and what communities need. So it ended up being a really, really great professional and personal experience for me.
And that's a great transition into the next section of my questions, because I'm curious what each of you did after you graduated from WNL, Berea, Furman. And I'd like to start with you, Kjersti, because I understand that you were a Peace Corps volunteer. And I'm curious if there were parallels between your SHEP experience and your decision to go into the Peace Corps, the things you did while you were there, and how that's shaped your decision to do what you're doing now in grad school.
Yeah, definitely. So like I said, my Shepherd internship was kind of my first hands-on experience with public health. And that kind of sparked my interest. And I went into, so that was between my sophomore and junior year of college. And I went into my junior year really feeling confident that public health is the area that I wanted to focus on. And I had a really great mentor at Furman who shared her experience with the Peace Corps with me and kind of encouraged me to explore that as an option. And so after I graduated, I joined the Peace Corps and lived in Lesotho, which is a small country in Southern Africa. And I was placed with the National AIDS Commission in Peace Corps. So I was mainly working with the national structure that worked on coordinating different organizations for HIV prevention activities in the Bute district. So I definitely saw a lot of parallels with the Shepherd program in terms of kind of pushing me outside of my comfort zone and getting to learn the culture and context and what kinds of social factors can affect health outcomes. And so I think, you know, the parallels really led me to the Peace Corps. And then now I can look back on my time and see really what skills I want to develop and hone in on in my graduate school program to make sure that I am equipped to be the best public health professional that I can be.
Thank you. I was very excited to hear about that when I read your bio. And Dan or Jamila, whichever one would like to go first, kind of talk about that journey immediately after undergrad and what led you to the work you're doing now.
You can feel free to go, Jamila, if you'd like.
Sure. So immediately after undergrad, I still was uncertain what my next steps would be. Kind of needed a year to recover from just undergrad was an interesting experience. It was an interesting ride for me. Lots of ups and downs. My family, we had a lot of transitions during that time. So I took a year off. My parents had moved to Charlotte, North Carolina, so spent a year at home with them. Did a quick stint as H&R Block during tax season as a client service professional, which I was basically a secretary for tax season. But during that fall, I think it was when I thought, wait a second, public health, why am I not going down this path? Because Dan talks about wanting to be a PA. I thought I wanted to be a pediatrician until I got to chemistry and realized there was no way I was going to continue on the path. I just wasn't going to make it through medical school. And then after the internship, it was kind of when I started to see that public health allowed me to stay in the healthcare industry and really kind of tied in all the things I was actually passionate about. When I did my capstone, I think during senior year, which started to click in the fall after, was when I realized that I didn't have to choose between my identities. Being from Guyana, we'd moved around a lot. So my capstone was actually about flooding, the effect of flooding in Guyana and in Marvel and Helena, Arkansas, because they actually have a history of flooding that was kind of a major event that led to a lot of their poverty issues. So it was kind of a moment for me of like, I can do work that are solutions to multiple communities that I felt a part of, and in interesting ways, right? So that started to click in the fall. I decided to take the GRE, apply to grad school, and specifically chose epidemiology because of the math background, and I thought that would be more applied. Eventually went to USF. While at USF, my sister pointed out that I had a degree in math, and because she was working on her PhD, and they had biostatisticians that helped them with their analyses. And she said, wouldn't it be great if I had a sister that could help me with my analyses? So I added the biostatistics as part of my concentration. So I decided to do both programs. When I finished the program, I started working for a company that had a lot of government contracts, and I specifically worked on the end-stage renal disease contract, and that kind of got me interested in the world of kidney disease. And I was also doing some research with some peers on health disparities, specifically around maternal and infant mortality in the Black community. And so, again, reinforcing exactly what I learned during that capstone, that I didn't have to choose between the things I was passionate about. I could be a part of all these worlds because, like Dan said, public health is there's this connectivity to so many things. I wanted to do more statistical analysis. I wanted to expand my SAS skills, programming skills. So I started to look for another job. I wasn't exactly happy at that job. I loved the community of the ESRD community, but not the immediate environment. And so I matched for this job in Green Bay, and Green Bay was on my list of places to live because I'm a huge Packers fan. And people were like, "You're from the Caribbean, how?" But I had been a Packers fan since our family lived in Jamaica, which is a whole other story. But I had always said, wouldn't it be cool if I could live in Green Bay and one day be on the board of directors for the Packers, because they're the only publicly owned team in the NFL. So matched for this job, kind of applied without really thinking about it. I was living in Tampa, Florida. Everyone was confused why someone was moving from Florida to Green Bay. And so I got the job, and it was an interesting transition to the health insurance industry. One of my interview questions from an actuary was, how do I feel about the health insurance companies? And it kind of felt like, oh, you guys are the enemy, public health and insurance companies. I feel like we're always on the opposite side. And but one of the things that was important to me was understanding the entire healthcare system. And I felt like health insurance in general was kind of a blind spot for me. I didn't know a lot about the insurance company, and they play an integral role in the US, in the healthcare system in the US. And so that was a major part of why I wanted to join the company. And at the time, they were kind of looking for different roles because of healthcare reform. And so it also felt like a good time to kind of bring that public health voice to my role. So that's how I ended up in a healthcare economics position. And of course, we've reorged a little bit, and our department name has probably changed a couple times, I'm sure. But that's how I've kind of transitioned into the health insurance company, but still definitely very much a part of the public health world, still continuing a lot of community involvement, still following a lot of research, and still making sure that I'm all those, again, those identities and communities that I'm passionate about, continuing to do work for those communities.
I have a bunch of follow-up questions, but I'll save them. One that I will ask you, all of you, is what you see yourself doing in the future and sort of like the direction you're headed. So I'd be curious for you, based on what you've said, like what's next and how this fits into the broader picture. But I'll turn it over to Dan to tell us about what happened after Berea.
Oh, well, I hope my answer is half as good as the previous two. So after I graduated Berea, I didn't really know what my next step would be in order to become a PA. I knew that I needed some more clinical experience. I had some during my college years, but really wanted to work in the field. So I actually got a job at a retina clinic right around in Lexington, about 40 minutes north of where I went to school. I worked there for a couple of years, kind of just understanding what sort of healthcare they provided, how did they affect the community, and how I could be part of that eventually. I landed a clinical supervisor position pretty early on, and so kind of really liked managing people, and kind of felt myself as leading the ones that are helping to provide care for everyone, because the front line is where a lot of the care happens, even though you're eventually moving on to the providers. Then moved to Texas for a couple of years. My now wife actually got into a master's program there, so moved to Texas and looked to join another retina practice. That had seemed where my interest had lied, and something I knew how to do. So started working for a much larger organization there, Texas Retina Associates. Didn't have any sort of management positions open, so I worked back on the front lines again, and that was fine with me. And then got promoted to an OSHA coordinator and kind of learned the whole safety side of things, and how do we promote employee safety and also protect patient safety, and work through, the government standards, but also what do we set forward as Texas Retina on how we are protecting patients and our employees. Saw myself in more of a management position than what I was at, but really enjoyed what I was doing, and didn't really know where to go next. Did I want to apply to PA school? Did I want to try something else in the healthcare field? Because again, I always knew I wanted to work with free clinics, but how was I going to get there? And did I see myself as a healthcare provider? That's the point where I just decided to research different healthcare careers and how I could be effective and kind of hit the goals that I wanted to do. Eventually ended up applying to the University of Iowa for a Master's of Healthcare and in Health Management and Policy. And something that was really interesting to me for this specific program, it wasn't just an MHA, but it had focus in healthcare management and healthcare policy. Something I never thought that I would be interested in healthcare policy, but really enjoy actually understanding and kind of breaking apart different sections of different policies and things like that. So that really was helpful for me when I was moving into more of this MHA role and realizing what I wanted to do. While at the university, part of the program is to do an internship. And so I did my internship at a local healthcare clinic here in Iowa called Physicians Clinic of Iowa. About 60 to 80 healthcare providers, and was working as an intern, working in different parts of administration, different parts of the 13 specialties that they provide, some revenue cycle things, really just understanding how healthcare was provided, every different portion that works on the back end versus what we just see when we go to a doctor for a checkup and things like that. Kind of laid the groundwork for what I wanted to do after my program. And when I graduated there, I actually continued to work for Physicians Clinic of Iowa, which is where I currently work. Got into more of an operations role, and I'm a healthcare operations manager, where I provide daily operations to all of my staff. I have 6 different clinics that I work with, do a lot of physician relations, people management, and I work with patients when they, have complaints or issues, but also want to tell us the great things that we've provided for them, and how do our clinics work together, working with referrals and different things. And then, my interest is still sort of in this healthcare policy. So really reading everything that's coming out that might be new and different. And like Jamila talked about, healthcare reform and things like that. Just on different committees with the Iowa MGMA group and trying to learn different things there. And where I see myself going next is actually, I'm taking on a new role as the revenue cycle director. So learning different portions of that and seeing how, businesses work with insurance companies, billing and coding, and how different sections of the more businessy parts of healthcare work, so that I can get more of a understanding on, the groundwork and maybe the outlay of healthcare in the next 5 years.
Very interesting. I heard a couple of themes in your comments. One, that internships don't end in undergrad, and there's opportunities to keep exploring. And 2, that this field can involve a very circuitous path. I see the role of mentors like all of you in helping people who are at an earlier stage in their education or in their career development, connecting with others who have, tried different things, explored different things, and how that can save time, perhaps, or even just open people's eyes to different avenues that they wouldn't have thought of otherwise, in terms of how to get into the field. So thank you for sharing those remarks. And because we have a few folks in the audience, I want to open up the floor for questions. If any of you would like to address the panelists directly or put something in the chat, I'm happy to take those questions or continue down my list. Mackenzie or Professor Beckley, Katya, how are you doing out there?
Hi, thanks everybody. I'm so happy to see everybody's face and be here with you all. I'm Kirsty's sister, as you all have figured out. I guess going off the theme of mentorship, was there a mentor that you all had in undergrad that you feel like really helped you sort of navigate your next steps? And if so, do you have any advice for like sort of staying in touch and keeping up with that relationship as you move into the next phases of life? I know one of my mentors, Professor Beckley, is right here. So Kirsty, I know I can think of yours, but we're curious about other people's too.
So for me, identifying a mentor was pretty easy. It was somebody in my biology department that I took multiple classes with. I kind of just outlined what did I want to do with my career and things, and they were very responsive to that, and they always made it a point to touch base with me during my undergrad and see where I was at with different things. I'm sure other colleges do it, but everyone gets that sort of professor that you report to about different things during your college time. And this person was actually not my, college original mentor person that I was supposed to talk to, but they kind of aligned more with where I saw my career going. Kept in touch even after college and after I graduated. The 2 years that I spent in Kentucky afterwards, they were very purposeful in reaching out to me and doing different things. And part of my master's program, actually, we set up with a mentor-mentee system where the second year student takes on a first year student to kind of mentor and walk them through the program and how do you apply to internships and what's a fellowship and different things we have. But I would say the number one thing is to be purposeful when you're either in the mentee or the mentor role, is that you want to be purposeful in contacting those people, because in this day and age, everybody's on social media and you might read their posts or you might think you're interacting with them in one way, but that can fall to the wayside very easily. And making sure that you're purposeful in reaching out to somebody and talking to them and making sure they're okay and what do you want to do and are you on that path? I think that's really important to be purposeful about those things.
Yeah, I have had a lot of mentors, but I'm very much a person who lands in something and then realizes like what I had, or like, oh, things click a little bit after. So, of course, Professor Beckley, who naturally comes up, part of the role too, and because of the poverty program was my advisor. Professor Crowley, who was a math professor at the time at Washington and Lee, also in that advisor role was somewhat of a mentor. But at the time, I probably wouldn't have used the word mentor. But as I've gone through my career, there are these flashes of moments that I realize how impactful they were. I think I now understand more the importance of mentorship, and now I'm a little bit more intentional in the people in my life right now. In Green Bay, I have a pretty close mentor who actually is on the board of directors for the Packers. That's just happenstance, but she has kind of just become a very close mentor. And I now realize how many things had I been this thoughtful in my approach to being mentored when I was younger, probably could have avoided a lot of pain. But thankfully, I've had a lot of good friends who have, I think, also served in some kind of mentorship role. friends who have listened and understood what I'm passionate about. And I can't believe I don't talk about this more, but two of my friends who have kind of been close friends since gosh, what would be equivalent to middle school in the US. They had this idea of opening a dialysis facility and had kind of known about my journey. They're like, oh, wait, you're in public health. You worked in the ESRD world. You'd be perfect to help us with this. And the three of us opened a dialysis facility in Jamaica. And so I'm on the board. I think we've been making up terms, but I'm the human resources director, i.e. the three of us just named ourselves directors based on the roles we kind of just took on. And I'll tie this into the question about 5 years. A big part of what we want to do is move from treatment to intervention. And we just have a lot of plans about how to start tackling some of the burden of disease, which is exactly, as a public health person, being able, what I would like to do. So my point is that I had friends who saw that path for me, and as they thought about their business goals, were thoughtful enough to include me, because I don't necessarily gravitate towards that entrepreneurial spirit, and they do. And so having friends that can also help you on your journey and introduce you to new opportunities and introduce you to things that you're compatible with.
Yeah, I think for me, mentors have definitely played a really big role in various stages of my professional and academic life. Two of my mentors are actually in this room right now. And I think one of the things I appreciate most about the mentors I've had is they've really encouraged me to seek out experiences and reflect and learn from those experiences rather than telling me what I should learn or what I should know. And I think that's really empowered me to figure out what I want to do and how I can use my skills and experience in the communities where I work. And I appreciate what Jamila said about friends being mentors as well, because I think we often think of a mentor-mentee relationship as a specific power dynamic or structure. But I think it's important to always try and have a mentor and also be a mentor. So that doesn't necessarily have to be like within a traditional power dynamic or structure. I think you can be mentors to your friends and your friends can mentor you, or classmates. I can think of some students when I was at Furman who were younger than me and maybe had less experience than me, but still taught me a lot of things that have been important in my professional career. So I think a good piece of advice to everyone is to seek out mentors and also seek out opportunities to mentor other people and share some of the lessons and experiences you've had.
Danielle,
Yes,
may I
nice to see you.
say some? I have one simple question of Katja, and is it Kjersti? How do you pronounce it?
Kirsty.
Kjersti.
Yes.
Does your family still live in Cary? Is that where you live, in Cary, North Carolina?
Yes, I'm in Atlanta now, but the family's in Cary.
Your family's still in Cary. Second question is, Katja, what are you doing? Are you still in education?
I am. Yes, I am a 6th grade math teacher in Baltimore City. So I did 5 years at a high school and decided to switch down and try middle school, which was quite an adventure for 8 months. And then we went virtual, which is another adventure. So yeah, still teaching in Baltimore.
Good. Third is, and I have something I want to say to Danielle. Third is, I don't know whether it was by design or happenstance that all of you are from Arkansas in your internships. Which one was it, Danielle? Did you design that?
No, I didn't. But as I was putting together the program, I was like, oh my gosh, what are the chances? 3 different schools, 3 different years.
what I will say about that is that my experience, which is a little distant, but not entirely distant, is that people generally weren't enthusiastic about going to Arkansas. Once they got there, they discovered very interesting things there. And I could name a lot of people like that. And you all suggested something similar to that. And I remember particularly a person named not Katja, I'm sorry, Kiana McKenzie. I don't know if any of you knew Kiana or not. Jamila did. She said, she was from the south side of Chicago. She said, what am I going to do in Arkansas? I said, you're going to see some poverty you've never seen before. And then she told the story of how it flooded, right? And she went out and she saw sewage running in the ditch, and she called her mother in the south side of Chicago and she said, Mom, I'm seeing sewage in the ditch. I never saw that in Chicago. And she found that an interesting experience. She's involved in politics in North Carolina right now. Do you keep up with her a little bit?
Not too close. I mean, social media, social media. But
Yeah.
Kiana was instrumental in making sure that my experience was, because she was just the year before mine. So
anyway, that Arkansas experience has had a deep influence on a lot of people because it's a different kind of poverty than you would normally experience elsewhere. And people have found that quite meaningful. Last thing, Danielle, is a comment to you. I think this idea of networking people from different schools who've been out for a while is very valuable. And if you could promote it and keep it going and expand it, I think y'all can learn a lot from each other 4 and 5 and 6 years out about what you're doing, what you can do to help each other. And Jamila, I would suggest, for example, you might be interested in getting in touch with a young person, and you just look up Colonnade Connections. Alvin Thomas is interested in public health and transplants of kidneys. And Alvin graduated long after you did. I doubt you know him, but he's at North Carolina now, and I think you would find it very interesting to be in touch with. And I want to encourage all of you to be in touch with each other much later, because you learn from each other quite a bit. So Danielle, that's actually a comment to you too. So.
Well, thank you. I have to say that Susie Giampalmo, who you know, and maybe some of the other folks in the audience know also, really spearheaded this idea with the sessions she held for students who were interested in medical school. And we ran with it. So we started to create sessions for different professions. So the first one was education. We've also looked at careers in law, in policy is coming up in May. So we're trying to kind of check all the boxes that appeal to SHEP alums, and we're always looking for new topics. So if there's something else that you think people would be interested in, I will work to create a panel of folks with diverse experiences, maybe not diverse internships, but I can't promise anything. So I have a few other questions. Does anyone else in the audience want to pose a question before I jump in? Mackenzie?
Hi, thank you all
Hi.
for being here tonight. I'm a junior in undergrad, so still learning a lot, and I'm thinking about going to public health school post-graduation. So could the three of you just touch on how you decided what school to go for your master's, and then what that process was like?
I can start. I think I'm the most recent. I'm only a first year, so I just started my master's in public health. And when I was looking at schools, one question that I really wanted to ask was what the learning environment was like. I know there are some schools that have a very like individual and more competitive academic culture. And because public health is really collaborative, and because I knew that that is the style that I learn best in, I really tried to get in touch with current students and faculty to ask about the learning environment and how students learn in classes. And so I decided to go to Emory because I heard a lot of great advice from current students about like how group projects and collaborative learning environments were really helpful for them. And I knew that was important to me. So, but there are so many great public health schools out there, and it can be overwhelming to look at opportunities. I thought when I was an undergrad, I thought I had figured it out because I knew I wanted to study public health. But then once you make that decision, like there's so many areas within public health that are so specific. So it's like a whole nother process of figuring out what you want to do within the field of public health.
So for me, I never had the thought to say, oh, I want to go to a school for public health. Mine was more, I want to be in healthcare management and help lead leaders, and then make it to the free clinic setting. But one thing that I was looking for in a school was how involved they were in the community around them. Does this giant school help and nourish the community and provide different programs for them, and what exactly do they do? And for me, why I chose Iowa was the fact that there's 99 counties in the state of Iowa, and the University of Iowa has some sort of program or something they do with every single one of the counties. So I thought for me that was really great, and something that I wanted to make sure that I could be part of, or I go to a school that is part of that and helping the entire state and not just where they're at.
Well, there weren't this many accredited schools of public health when I was applying to grad school in 2010, believe it or not. So my biggest driver was that my sister was at UF working on her PhD, and we thought, let's go to grad school together. And so I applied to USF because they were the closest accredited school, I believe. So UF was just starting their public health program, and they did not have accreditation at the time. And so that was I guess I can't go to UF with you, which probably was better for our relationship anyway, to not be at the exact same, in the exact same city. The process though, so outside of limited options and then location, I think that's probably the combination that also made it feel like there weren't a lot of options. East Coast, closer to family, and accredited were the kind of the criteria. But listening to some of my colleagues, I know I had friends that came in kind of, I want to work with Dr. such and such because of their research. So I guess, again, being that person in retrospect, I'm like, probably should have done some of that research, to see if there were some professors that I connected with their work, kind of seeing what the universities are involved in, opportunities for student research. While I was a student at USF, was able to work on a student challenge grant. And so we were students working on research funded by the university. And so that also was something that I hadn't thought about, that opportunity giving me a stepping stone when I graduated. So in retrospect, probably should have done a little bit more research. Thankfully worked out for me. But if you're interested in just opportunities that you might be interested in, making sure that the school will have those kinds of opportunities for you as a student.
Kirsty, have you met Jonathan Wortham at the CDC? Kirsty?
No, I have not.
You should. Danielle, do you know Jonathan?
I don't know him, but I know who you're talking about, and he gave a recent presentation, right?
Yes, and those two should be in touch, since he also is on the Emory faculty and is involved in public health.
That makes a lot of sense. Yeah, Kirsty, I can send you the information.
That'd be great. Thanks.
And I had a follow-up thought about this idea of trying to decide which program and which school. This is a tidbit that I gleaned from the Careers in Social Services panel, so I'll just share it with you now. We were talking about degrees in social work or degrees in psychology, counseling, you know, kind of all of those like social services professions. And I see some parallels here. There's a lot of different routes you can go that could lead to a similar, you know, position per se, like they might hire people with different degrees. But what the women on the panel said was to really look at the people they admire in positions of leadership or people who are 5 years farther along in their career development and see what degrees they got. So kind of going backwards in a way and envisioning the place you'd like to be in, and then seeing the different paths that people have taken to get there. And another tidbit that they shared was, you know, of course, going to career services on your campus or scheduling an appointment with your career advisor and asking them to connect you with people who are doing the work that interests you and having those same types of conversations. Or even if you don't want to have a conversation, going on LinkedIn and seeing like, did they get an MPP or an MPA, or, you know, what did they do, MPH, whatever it is, and thinking about it. And the last thing that I would share is a resource called Pro Fellow. And Pro Fellow consolidates a lot of funding opportunities for fellowships and graduate school. Their kind of ethos is that people shouldn't pay a lot for higher education, especially people who want to do good in the world. And so there are always opportunities advertised for programs that offer graduate assistantships or stipends or other fellowships that can help you offset those costs so that you can go out in the world and do the work that you want to do right away, as opposed to, you know, servicing your debt for a long time. Anybody else have a question from the audience? All right. I have the follow-up question about what you see yourself doing in 5 years. So we could tackle that, or we could go into, you know, what you do for self-care, for balance, like how do you stay motivated to do this work, especially now in the times that we're all living in. You know, what do you do when you get discouraged, and how do you see yourself being motivated to continue in this field going forward? Anyone can jump in.
Well, I can kind of touch on both. Well, so the 5 years, I'll be a little bit more brief. So I do want to be a little bit more involved in business decision making on a United Health Group front. Kind of, I think that would bring me full circle in feeling like I've truly conquered that health insurance understanding, right? If I can be a part of, not just provide analyses and inform the decision making, but truly be a part of that business decision making is something that I would like to get more involved in. And then on the dialysis facility side, we do have dreams of expansion, and then going into that intervention and community impact work, maybe even the direction of a foundation. And then with all of these things, the balancing, so that mentor, and her name is Robin, she's also a huge outlet for me. She's somebody who we unpack a lot of things, and so from a self-care perspective, has been instrumental in keeping me sane. Family, for those who do have family members that they're close to, that's something that that's a part of me. I know when I'm reaching the point of burnout, it means I probably need to just take a trip home, where my mom will cook for me and my dad will drive me around, and I don't have to do too much for myself. And we've reached a point where I don't go home enough that they get so excited about me coming to visit that it's a huge, like they're so excited that they're willing to just drop everything for me. And so that's a huge like that's usually when I feel myself getting too exhausted, turn to family. And my nephew for me is just always a reminder of that future, why I'm doing all of this, and hoping to just hopefully see him enter a world when he's my age or older, that he's tackling some different issues and not these same kinds of obstacles.
So these are both great questions, and questions that I find myself still asking myself every day. In 5 years, I don't exactly know what I'm going to be doing. I think, I'm only a first year in my MPH program, and I think that our culture focuses a lot on like, what's the next step constantly. So right now I'm trying to enjoy where I am and like really enjoy learning, and hope that I'll figure it out when I get there. But I do think in that process, I've learned that I'm really interested in sexual and reproductive health access and justice. And so I see myself working in that area, whether it's research or government positions. I'm open to the idea of more schooling after my master's degree. So I'm just taking it one day at a time for now. And I think as far as self-care goes, I think it's really important, especially when you're working in this field, to figure out what works best for you. I think it's easy to get really caught up in everything when you tie your values to your career and your professional aspirations. For me, I really enjoy journaling, and it helps me like get my thoughts out of my mind and elsewhere. So that's been really a good way for me to reflect on my experiences and kind of figure out what lessons I'm learning, but not keep them inside. But that doesn't work for everyone. So I think taking some time for yourself to learn what works for you, and how can you stay grounded and keep hope and keep passion in these times. It could be kind of easy to become a little bit cynical these days, but I think it's also really important to remember why you became interested in public health in the first place, and figure out what you need to do to stay motivated and keep a positive outlook.
I'd say for me, some self-care stuff. I just kind of, my drive home every day is my time, and I just like to, I don't even turn the radio on or anything. I just like to think about my day, kind of decompress. And I'm in management, so I have a like tendency to bring my work home with me and work on it there, and know what I'm getting into the next day and kind of finish all these tasks. But kind of try and leave that at work, and be with my family as much as possible when I'm actually here, and enjoy the moment and what I'm living in now. And in 5 years, I'm kind of like you, Kirsty, as I don't really want to think about that. I kind of want to enjoy where I'm at and what I'm doing, and keep my focus sort of here. I don't know what I see myself doing in 5 years. Hopefully it's still healthcare management, since I've spent some time doing this. But yeah, I don't really know. Another thing that I have found that has really helped me kind of decompress and continue on, especially in this world of the pandemic, is talk to those that I work with, fellow employees and people in the same position that I'm at, but not about work issues, about life and different things that they're going through and what I'm going through, knowing that we have similar work problems and things that we're working through each day, but kind of getting to know people on a different level, and more about their personality and their personal self and different things that they're wanting to do with their lives. It kind of helps you be in that work set of mind, but also not at the same time.
I love that. And I love the present, the focus on being present and being in the now. I think we've all been reminded in one way or another how precious life is and how short it can be. If we make these grand 50-year plans, nothing is guaranteed. So I appreciate all of you for sharing that reminder and helping us stay focused on hope and what's important. And Jamila, your wish that your nephew doesn't confront the same issues that you're facing, I think is a very, very important one. I find myself thinking about climate justice a lot these days, and I share your hope that we will do what we need to do now so that there's a clean, safe world for people to inhabit when they get older too. Does anyone else have a question or a parting thought before we close out for tonight?
I do have one question. Have you met Aaron Rodgers?
I have, and I have a picture of him. Yes, I picture of him with him. I'm in the picture too. That's the important part. Yes. So I'm a big sister with big brothers, big sisters, and so we were invited to a pizza party. We weren't told who was going to be the guest, and it was Aaron Rodgers. Even they didn't know. The agency didn't know. My little happens to be a Chicago Bears fan, and Aaron Rodgers comes to our table, and we had just lost to the Bears in a very brutal loss. And she says, "Yeah, I'm a Bears fan." And I'm like, "It's Aaron Rodgers." And we're like, "Do you want a picture?" And she goes, "Nah, not really." I like, "No, you can't. 10-year-old, like, you're gonna regret this." And so he was awesome with her. I mean, he was very much engaged with the kids, and he played around, joked around with her. And then I actually got a picture of them like playing, like, just playing around a little bit and laughing. So yes, it worked out great, and I think she'll now appreciate that we have a picture of her and Aaron Rodgers. But yeah, he was great.
And Mackenzie, I have a quick question. I'm curious where you go to school. I know you told us what year you're in.
Yeah, I go to Hamilton. And I actually had a closing question, I guess. I just joined the chef program like within this last month, so I'll be doing my internship this summer. So I was just wondering if any of you have any advice on how to like make the most out of the program.
I mean, I'll say just go in with an open mind, enjoy it. I think even if there's some difficult moments, trying not to focus on the negative and think about all you're gaining would be that's my immediate thought. I personally, again, things that I don't, Dr. Beckley's voice, like in retrospect, I can think of times during my internship where things in my class clicked, probably didn't reflect in my grades, but during the experience, for sure, I started to just think about some of the conversations and why we read the books we read, and just started to make those connections. So, I mean, I guess not enjoy it. Maybe not. I don't want to say make it too academic, but if you can think of some of the courses, I don't know what courses you've taken, but some of the courses and some of the preparation, looking for real life experiences to apply those points, that I think was helpful for me.
I would accentuate that. I'm something of a theologian, and there is a field called liberation theology, which you may or may not have ever heard of. But one of the emphasis is the epistemological, if not privilege, exclusive privilege, at least privilege, or the special situation that people who are vulnerable are in, and how much others of us have to learn from them. And an internship can be a wonderful time to learn from people that we might not otherwise get to know. Now, you won't have the firsthand experience quite like all these folks did, but you probably will have some of it. Danielle knows more about that than I do. But if you can learn from the people that are in the location where you're primarily focused, that will be very beneficial to you.
Dan, did you want to jump in there? I saw you take yourself off mute.
Yeah, I just wanted to kind of echo what Jamila said, and that first thought of, go in with an open mind, don't have any negativity toward it. it's going to be a good experience. You're going to learn. Make sure that you understand that what you're learning there is going to be beneficial. Everything that you're going to see and do and different things, it's going to be beneficial for your future and kind of give you more of a picture of things you might not understand. So, go in with the idea that you're going to learn and you're going to enjoy your time.
Yeah, I definitely echo what others have said. And I think always when you're working in public health, but especially like in your Shepherd internship, really thinking about like when do you want to bring your knowledge and expertise to the conversation, and when do you want to take a step back and learn from the situation before sharing your thoughts. I think that's a really valuable skill to have. So reflecting on that, and I always recommend like keeping a list of lessons learned or things that you were involved in, and kind of reflecting on what you're taking away from the experience as well as what you can give.
I'll share a practical piece of advice from my experience as a cohort mentor last year. So all of the interns in my cohort were doing virtual internships, and one of them had very high hopes of interacting with patients at a clinic. Well, of course, it was different because she wasn't at the clinic. And so I think there was that initial kind of disappointment because her expectations had been one thing and then everything changed. And so she, I think wisely, voiced that disappointment to me and my other cohort co-mentor. And we were able to work with her to reposition her experience in light of current circumstances, so that she could see that even though she wasn't doing the direct client interaction that she expected, the work she was doing was very, very important. And it was a matter of perspective. It wasn't anything, drastically different. It was the same placement. It was the same intern, but it was the way that she viewed the tasks that she was being given. And she ended up having an amazing final presentation. So she got a lot out of it. And I think that expectations make a big difference in terms of how people progress through the 8 weeks, because there's like that honeymoon phase, and then there's like, oh my gosh, right? And then by the time it's over, you're like, wow, it was so fast. So just keep a positive attitude and don't be afraid to reach out for assistance from your supervisor, from your cohort mentor, from anybody else who you feel comfortable talking with. Sometimes just taking the time to put it out there can help you see it in a slightly different way. And I know you're going to have a good experience. Well, I think, Miss Professor Beckley.
Please say hello. Is it your dean or provost, Suzanne Keene?
Oh, yeah, at Hamilton.
He's from Washington Lee. Did you know that,
Mackenzie? I did not know that.
She's amazing. I did my poverty English course with her. Amazing.
Give her greetings from several of us then.
I will. I definitely will.
Well, thank you all so much for your time this evening. It was a tremendous pleasure for me to interact with all of you and to see some familiar faces again. If there's anything that I can do or that Shep can do to connect you with others who have experiences that you're interested in, please don't hesitate to reach out. And like I said, if there are other career paths that you think Shep alums would be interested in learning more about, I welcome your suggestions. They really do come from alums themselves saying, hey, I know somebody who's working in this field, or I'm doing this, I'd love to share it. The panel that's coming up in May is about public policy and social entrepreneurship, and features 3 alumna who are doing really exciting things all across the country. So I hope you'll join us, and thank you so much. Stay well. See you next time.
Thank you.